Every year, millions of seniors go in for routine checkups thinking they're doing the right thing. But what if I told you that some of these tests might actually increase your stroke risk overnight? Sounds hard to believe, right? You trust your doctor, you follow all the recommendations, but hidden in the fine print of modern medicine are silent risks no one warns you about. It's not the news, not the brochures at your clinic, and sometimes not even your doctor who talks about it. Imagine leaving your annual checkup thinking everything is fine, only to experience dizziness, blurred vision, or worse just days later. And you're left wondering, what just happened? The truth is, certain diagnostic tests, especially when done too often or under certain health conditions, can quietly trigger sudden spikes in blood pressure, disrupt blood flow, and even set off a chain reaction that can end in stroke. But don't worry, this video isn't here to scare you. It's here to inform you so you can ask better questions, so you can protect yourself and your loved ones. Because after age 60, it's not just about catching problems early, it's about avoiding the ones we might accidentally cause. In the next few minutes, we'll uncover the 5 most common medical tests that may carry hidden stroke risks, especially for seniors. More importantly, you'll learn exactly how to protect yourself before your next appointment. If you're over 60, type 1 in the comments. If not, type 0. And don't forget to subscribe to Longevity, where we reveal what others won't tell you. Let's start with the first test you should think twice about. If you've ever had a CT scan with contrast, you might remember that warm, flushed feeling spreading through your body. That's the contrast dye doing its job, helping your doctor see your blood vessels, organs, and tissues more clearly. Sounds helpful, right? But here's something many seniors never learn. That little injection can do much more than just improve images. It can silently stress your cardiovascular system, especially if you're over 60 and already dealing with high blood pressure, heart problems, or kidney issues. For some people, the contrast dye triggers a vasovagal reaction, a sudden drop in heart rate and blood pressure. This can cause dizziness, nausea, fainting, or even brief loss of consciousness. But in other cases, the opposite happens. Blood pressure spikes rapidly and fragile vessels can constrict or spasm. When that occurs, the risk of stroke or cardiac event quietly creeps in. A study published in the Journal of Vascular and Interventional Radiology found that older adults who underwent contrast-enhanced CT scans had a significantly higher rate of vascular complications within 72 hours, especially those with a history of hypertension, cardiovascular disease, or impaired kidney function. In short, the more vulnerable your system, the more dangerous the contrast dye can be. Let me share a real case. An 81-year-old man underwent a routine abdominal CT scan after mild digestive discomfort. The scan came back normal, and he went home feeling fine. But 2 days later, he suffered a minor stroke. The likely cause was the contrast injection, which may have temporarily raised his blood pressure, causing a clot that blocked blood flow to part of his brain. This doesn't mean CT scans with contrast are bad, far from it. They can detect cancers, clots, aneurysms, things that save lives. But the key point is, these scans should be used wisely, not routinely, just in case. What can you do to protect yourself? Before agreeing to a contrast CT scan, ask your doctor, is this scan essential? Is there a safer option for someone my age and health condition? Share your full medical history, especially if you have high blood pressure, kidney or heart problems, previous reactions to contrast dye or medications, and always ask, can this be done without contrast? Often, a non-contrast CT or an ultrasound provides enough detail without additional risks. Now let's talk about another test many seniors get even if they feel fine, but it may not be as harmless as it seems: the cardiac stress test. On paper, it sounds like a smart idea. Put on a heart monitor, walk on a treadmill, and see how your heart performs under pressure. But if you're over 60, especially with high blood pressure or heart conditions, this test can be risky. During the test, you walk or even jog on a treadmill while your heart rate is closely monitored. As speed increases, your heart rate shoots up, blood pressure rises, and your cardiovascular system undergoes intense strain. For a healthy young person, this might not be a problem, but for seniors, especially those with pre-existing conditions, It's like lighting a fire near dry brush. It can trigger serious complications. Some risks include dangerous blood pressure spikes, sudden arrhythmias, irregular heartbeats, and in rare cases, small tears in fragile vessels, especially in the brain. A 2020 study in the American Journal of Cardiology followed more than 1,300 patients over age 65 who underwent treadmill stress tests. Nearly 7% experienced harmful events during the test, including blood pressure surges and abnormal heart rhythms. The most affected group was those who already had vascular issues. This isn't just theory, it's real life. A 74-year-old woman with high blood pressure did the test on medical recommendation. Midway through the treadmill portion, she felt dizzy and chest pain. The test was stopped, but the next day she suffered a minor stroke. Doctors believe the sudden spike in her blood pressure during the test ruptured a small vessel in her brain. Clearly, the test didn't directly cause the stroke, but stressed an already vulnerable system, tipping the balance. So the lesson is, talk to your doctor. Ask, is there a safer way to evaluate my heart? In many cases, a pharmacological stress test or a resting echocardiogram may be better options for seniors. If you don't experience symptoms like chest pain, shortness of breath, or fatigue, ask whether the test is really necessary now or if it can wait. Now let's talk about another routine test that seems harmless but can carry hidden risks if not done carefully: endoscopy. Whether to check your esophagus, stomach, or colon, doctors often recommend it just to be safe. Sometimes that makes sense, but there's a hidden side. People over 60 often take blood thinners like warfarin, aspirin, or Plavix. When sedated for endoscopy, blood pressure and circulation naturally change. Combined with blood-thinning medications, the risk of internal bleeding or brain circulation problems increases, potentially causing a silent stroke. A 2021 study published in Gastrointestinal Endoscopy found that patients over 65 who underwent sedated endoscopy had a significant increase in transient ischemic attacks, or TIAs or mini-strokes, within 72 hours after the procedure. These weren't major strokes, but were warning signs of blood flow problems in the brain. One memorable case was a 76-year-old woman who had a routine colonoscopy with sedation. She had no prior symptoms, but 2 days later developed slurred speech and loss of coordination. The hospital confirmed she had a mild stroke. Doctors believed the blood pressure drop during sedation, combined with her daily aspirin use, created the right conditions for a clot. The procedure itself has low risk, but the combination of sedation, age, and medications can create a perfect storm. This doesn't mean you should avoid endoscopies, but don't agree to one unless your doctor clearly explains why it's necessary right now. If it's just because some time has passed, ask if there's a safer way to monitor your condition, especially if you have no symptoms. Always inform your doctor about your medications. Ask, do I need to stop blood thinners before this? What are the risks of sedation at my age? Can it be done without sedation or with lighter options? Next, let's talk about another test often overlooked but involving something many never think about: the kidneys. MRI scans are powerful tools that help doctors see deep inside your body, detect early signs of problems, and sometimes avoid unnecessary surgeries. But when contrast dye is added, usually to get clearer images, caution is needed, especially for older adults and those with even mild kidney problems. The contrast contains gadolinium, a heavy metal meant to be flushed out by your kidneys. After 60, kidney function naturally declines, and those with chronic kidney disease or reduced function may accumulate gadolinium, which can be dangerous. Retention of gadolinium has been linked to a rare but serious condition called nephrogenic systemic fibrosis, which hardens and thickens the skin and connective tissues, limiting movement, breathing, and even affecting organs. Additionally, gadolinium has been found in brain tissues, and some researchers believe it may cause subtle neurological symptoms like confusion and dizziness, especially in those already at risk for circulatory problems. A 2019 study published in Radiology tracked more than 2,000 patients over 65 who received contrast-enhanced MRIs. About 5% reported stroke-like symptoms, headaches, blurred vision, and balance problems within a week of the procedure. Most had diagnosed or undiagnosed kidney issues. One case was Harold, a 79-year-old veteran from Arizona who had an MRI with contrast for persistent back pain. 2 days later, he felt weak,
confused, and foggy mentally, symptoms that lasted nearly a week. Test revealed he had stage 3 kidney disease. "No one warned me," he said. "If I had known, I would have asked more questions." What can you do? If your doctor recommends a contrast MRI, ask, "Can we do it without contrast?" Often the answer is yes. If contrast is truly necessary, ask for a kidney function test first. It's a simple blood test called GFR, which gives you and your doctor peace of mind. Also, tell your doctor if you've ever had strange reactions to imaging tests before. Remember, the MRI itself isn't the problem. It's the extra chemical your body might not process well. With the right precautions, you can still get the answers you need without risking your brain or kidneys.
Now, let's talk about a test that seems harmless and smart to do regularly, but may lead seniors to risky surgeries they might not need: the carotid artery ultrasound. It's non-invasive, quick, and involves no needles, dyes, or loud machines. Sounds like the perfect preventative test, right? But here's what most seniors don't know. If you don't have symptoms and your doctor orders this scan just to check, it might lead you down a path to surgery you never needed. The carotid arteries deliver blood to your brain. Over time, like many vessels in the body, they can develop plaques of cholesterol or calcium, which is normal with age. But not all plaques need to be removed. Often, it's safer to monitor them than to operate. Here's where things can go wrong. Say you get the test and it shows narrowing of 50% or 60%. Sounds scary, right? So your doctor refers you to a vascular surgeon, and suddenly you're told to consider procedures like carotid endarterectomy or stenting. But if you have no symptoms, no dizziness, no vision changes, no weakness, these procedures might offer little benefit and carry real risks. A major study published in the New England Journal of Medicine followed over 3,000 seniors with moderate carotid narrowing, but no symptoms. They found that surgery did not significantly reduce stroke risk more than medication and lifestyle changes. Even worse, a small percentage of patients who had surgery experienced strokes caused by the procedure, either during or after. One case that stands out is Helen, 82, from Pennsylvania. She went for a checkup, felt fine, and had a carotid ultrasound as a precaution. The test showed 65% narrowing. She was referred for surgery within weeks. Unfortunately, she suffered a minor stroke during the procedure. She survived, but was left with partial weakness on her right side. She said, "I wish I had known doing nothing might have been safer." What should you do? If your doctor orders a carotid ultrasound and you have no symptoms, ask, "What are we looking for?" And if we find something, what happens next? Will it change my treatment or just worry me? If you're already on blood pressure and cholesterol medications and living a healthy lifestyle, extra tests might not make much difference. If you've already had a scan showing narrowing, don't panic. Ask about follow-up scans instead of rushing into surgery, and always get a second opinion before any vascular procedure. To finish, some warm advice and a gentle reminder. Your health is in your hands. Not every test is dangerous, but not every test is necessary, especially after 60. Our bodies respond differently. What seems routine, like contrast dye, sedation, or scanning, can have effects we don't always anticipate. A simple injection might spike your blood pressure. A test might trigger a reaction. Even a quick checkup can carry risks if your system is already vulnerable. That's why it's so important to pause, ask questions, and make sure every test fits your health needs, not just a checklist or protocol. You have every right to say, "Is this really necessary? Can we explore a safer alternative?" Because informed decisions lead to better outcomes and peace of mind. Your health story matters. Your voice matters. Here, we believe every choice should be guided by knowledge, not fear or habit. When it comes to preventing stroke and caring for your health after 60, one fundamental point is the correct use of medications. As we age, many people take multiple medicines for blood pressure, diabetes, cholesterol, and other common conditions. And that's where a big challenge lies: drug interactions. What are drug interactions?
Basically, it's when one medicine interferes with another, either increasing its effect, decreasing it, or causing unexpected side effects. This can happen with medicines for heart, blood pressure, anxiety, or even natural supplements. Why are they more common in seniors? As we age, our metabolism changes, as do kidney and liver functions, organs responsible for processing and eliminating medicines. This can cause medicines to stay in the body longer or be eliminated differently, increasing the risk of adverse effects. Also, seniors often have multiple illnesses at once, which leads to multiple prescriptions, raising the chances of interactions. What are the risks? Interactions can increase the chance of bleeding, especially in those on blood thinners, can cause blood pressure to rise or fall too much, trigger arrhythmias, dizziness, falls, and even worsen kidney and liver function. How to avoid problems? Always keep an updated list of all your medicines, including regular, occasional, and natural supplements. Inform all your doctors about every medicine you take, even over-the-counter ones. Never stop or change doses without consulting your doctor. Ask your pharmacist or doctor about possible interactions before starting a new medicine. Pay attention to your body. If you feel dizzy, extremely tired, short of breath, swollen, unusual bleeding, or any strange symptoms, seek medical help promptly. If possible, have regular checkups with a geriatrician, a specialist in elder care who's better prepared to evaluate these interactions. Important reminder: the goal of medicines is to protect your health and quality of life. Knowing how to use them correctly is just as important as taking them. How to interpret test results without anxiety and avoid rash decisions. Getting medical test results can be stressful, especially if you're over 60 and focused on heart, brain, and circulation health. But understanding the numbers and what they mean can make all the difference to stay calm and act wisely. Why is interpreting tests confusing? Test reports use technical terms, reference ranges, and degrees of abnormality that are not always clearly explained by doctors or clinics. This can cause unnecessary fear, leading to over-worry or rash decisions like repeating tests or intensive treatments that may not be necessary. What to do to better interpret results? Ask your doctor to explain the results in detail, pointing out what is normal and what is not. Understand that not every out-of-range result is an immediate alarm. Many abnormalities are mild, temporary, or can be managed with lifestyle changes before medication. Learn about the reference values for your age group, as what's normal for a young person may not be for a senior, or vice versa. Avoid looking up information on the internet without criteria, as this can increase anxiety with incorrect or alarmist data. Always prefer reliable sources and consult qualified professionals. Practical example: imagine your cholesterol test came back slightly high. What does that mean? It could be a signal to adjust your diet, exercise more, or start medication. But there's no need to panic and think you immediately have serious heart problems. Regular monitoring and gradual follow-up are key to control. Importance of regular medical follow-up. A test is just a snapshot in time. Continuous analysis with repeated tests and clinical evaluation gives the real picture of your health progress or control. Remember, calmness and knowledge help you make better decisions, avoiding stress that can harm cardiovascular health. Use your tests as allies, not as sources of fear. Stroke: what you need to know. Stroke, or cerebrovascular accident, is one of the leading causes of disability and death worldwide, especially among people over 60. So understanding its types, causes, and early symptoms is crucial to act fast and increase chances of recovery. Main types of stroke. Ischemic stroke, the most common type, responsible for about 85% of cases. It happens when a blood vessel carrying blood to the brain is blocked, usually by a clot or fatty plaque, stopping circulation in that area. Without blood, brain cells begin to die quickly. Hemorrhagic stroke occurs when a blood vessel in the brain bursts, causing bleeding inside or around brain tissue. This hemorrhage increases pressure inside the skull and impairs brain function. Most common causes of stroke: uncontrolled high blood pressure, heart diseases like atrial fibrillation that can cause clots, poorly controlled diabetes, high cholesterol and atherosclerosis, artery blockage, smoking and excessive alcohol consumption, sedentary lifestyle and obesity, advanced age. Early symptoms you shouldn't ignore. Recognizing symptoms quickly can save lives. Remember the simple test called FAST. Face, drooping face or uneven smile. Arms, weakness or numbness in one arm. Speech, difficulty speaking or understanding. Time, if you notice any of these signs, act fast. Other symptoms include sudden severe headache, loss of balance, confusion, or blurred or double vision. Why rapid diagnosis is crucial. The brain depends on a constant supply of oxygen and nutrients through the blood. The longer blood flow is interrupted, the greater the damage and the lower the chance of full recovery. In ischemic stroke cases, there is a window of time to administer clot-dissolving medications, usually up to 4.5 hours after symptom onset. Recognizing signs and seeking immediate medical help can mean the difference between returning to normal life or suffering serious disabilities. In hemorrhagic stroke, quick assessment and control of blood pressure and bleeding are vital to prevent worsening. Prevention is the best medicine. Controlling blood pressure, managing diabetes, eating a healthy diet, exercising, and avoiding tobacco greatly reduce stroke risk. If you've ever felt strange after a test or seen a loved one go through this, type 1 in the comments. If not, type 0. Let's share, connect, and learn together. If this video helped you feel more aware, in control, or just curious, subscribe to Longevity. We're here to reveal the truth, ask the tough questions, and always look out for your well-being.